Hey, everybody. Welcome back to the Func Med Nation podcast. Today, I'm talking to Dr. Ryan Cedermark. Ryan graduated Magna Cum Laude from Life University in 2011. While in school, Dr. Cedermark enrolled in postgraduate neurology courses, earning his Diplomate in neurology from the American Chiropractic Neurology Board in 2013. Passionate about a multidisciplinary approach to healthcare, Dr. Cedermark graduated Magna Cum Laude with his Bachelor of Science in Nursing from Duke University and completed a Family Nurse Practitioner program at Georgia State University in 2018. He currently serves as the adjunct faculty at National University, teaching in the master's program. He's also the clinical director at Neurosolution Center of Atlanta, and he's also a certified functional medicine practitioner and serves on the board of the International Association of Functional Neurology and Rehab, also known as IAFNR, as well as the Medical Advisory Board for SNA Biotech. His multidisciplinary educational background creates a unique approach in today's healthcare environment. Without further ado, here is Dr. Cedermark. Welcome back, everybody. This is the Func Med Nation podcast. I'm Dr. Steve Noseworthy, your host, and today I get the pleasure of talking to what, in my mind, I refer to as one of the young studs, which is probably unfair because you've been around for a while now. But
I don't feel young anymore.
Well, it's crazy. It changes over time, like it sneaks up on you. But I think in context, I think you and I met. Were you graduated? Had you just graduated when you first started doing Func Med seminars?
I got my toes wet in school, and then afterwards I got more involved. I think I may have met you while I was still in the program, and then followed along with some of your teachings after.
Yeah. I just realized I didn't even say your name, but if someone's listening to the podcast, this is Dr. Ryan Cedermark.
Everybody.
So you have, one of the things that amazes me, because I've kind of lurked in the shadows and watched some of the stuff that you've done, just mostly through what you've posted on social media, and then you got involved with IAFNR, and you've just done a ton of stuff. Like for someone who's been in practice, and I'm going to say only 10 to 12 years, and that's obviously all relative, because when I first started, 10 years in practice seemed like an awful long way, but looking back now, it doesn't seem all that much. But you've accomplished a ton of different things, and not just in terms of like professional accomplishment within the field of chiropractic, but you've really branched out beyond that. And so talk to me, let's go back to, you just mentioned that you started doing Func Med when it was probably the last year of your training as a chiro?
Yeah, I think that's when I started to try to expand more from the neurology stuff that I was learning. So
right. Yeah. So let's go back to, because I have a question about like where and how I got kind of turned on to the whole functional neurology thing. And what's your story? Like, how did you get exposed to the idea of functional neurology? And at what point did you go, wow, I think I need to look into this and start learning this stuff?
Yeah, it was kind of, my family, I don't come from like a family of chiropractors. So I just had so many questions in the program, like how exactly does it work? What's it doing to the body? What's it doing to the brain? And at the time when I was in school, Dr. Carrick through the Carrick Institute was having speakers come to campus and offer the Diplomate program, which was a 300-hour course that you took, and you could sit to get, the Diplomate in neurology. Yeah. So I didn't go that route first. I was like, I don't know, school's enough. We had a teacher on campus. You may know Dr. James Duffy.
I know the name.
Okay. He was involved with the neurology club, which is where I kind of got my toes wet in the neurology world.
Sure.
And then I remember one day I call it like a frat house. When I was in chiropractic school, I lived with a bunch of buddies, and we would wake up and go to the gym and then go to class and then go back to the gym, or like be outside doing something. And he pulled me aside one day at the gym, and he was like, if you actually like did something else than go to the gym, like applied yourself in your studies, you could make something of yourself. And it was kind of like, geez, thanks a lot, man. But that's when I started to look more into the neurology. And for me, the neurology was just so eye-opening, because when I heard the speakers present, they made sense of what I was learning in the classroom. Yeah. So that's why I went deep into that, because it really kind of helped shift my focus and keep my focus while I was in the classroom so that I could get better in and outside and within that program.
Yeah. Yeah. And I had somewhat of a similar exposure to Carrick. In fact, Ted was still teaching personally when I first started taking the program. And this was back in probably 94, 95, because I graduated from Logan in 95. And I had the same, sensation, or the same sense or impression of like, I call it the clunk moment, where two pieces connect and you're like, okay, well, this now makes sense, what I'm learning in school and what I'm learning in clinic, as to why there's sometimes such miraculous responses to some type of manual therapy. And I'm using that in a very, very broad and non-exclusive term. So because there's going to be a lot of people listening to this podcast that don't come from the backgrounds that you and I share, and maybe they've heard of functional neurology, maybe they haven't. And I don't want to turn this into a talk exclusively about that, but it's such a big part of your background. And you can touch base on whether or not you're still using that in clinical practice. But like, from your perspective, like, how would you define functional neurology? And maybe even more importantly, how does that fit into a paradigm of functional medicine as a healthcare approach? And to be honest, Ryan, I'm still struggling myself to wrap my head around whether or not functional neurology is part of functional medicine, or functional medicine is part of neurology, or is it almost indistinguishable, kind of like the front and back of my hand? It's still my hand, but like, which part are you talking about? So how do you see all that? How do you see these things interrelating?
So for me, I was always interested in nutrition as well. And then when you're learning functional neurology, you're trying to learn, within functional neurology. And for people that aren't super familiar with it, in school, we learn about like pathological, neurological signs and symptoms. What I really gathered from going into the functional neurology program was that within the nervous system, you could have function, but there could be subtle dysfunction that leads to overall issues. And that could translate into like learning difficulties, difficulty performing at an optimal level in a sport, things like that. So what I took from that is, if you're looking for optimal function within the nervous system, one of the things that feeds the cells is nutrition. So if you're trying to optimize brain function, how do you do that without really trying to understand the physiological side of things and how well the person's body is receiving nutrition, and utilizing what it takes in? So that's kind of where my mind always goes. And that's how I work in the clinic. Our clinic is very functional neurology and neuro rehab based, but we also do a lot of focus on functional medicine and trying to optimize the body's physiology so that it can receive therapies and the brain can work better during the course of their treatment. So I don't know if that answers your question.
Yeah, no, I think it does. And just to kind of echo back to you, what I'm hearing is that people who do functional medicine, I think, already have this concept that you have disease states and you have states of dysfunction. And, the way that we look at the clinical model that I use and that I've taught in seminars, especially in using blood chemistry and looking at optimal ranges of blood values and markers compared to lab reference ranges that might reflect more of a pathophysiological state, the brain is much the same way, right? You can have inefficiency of function, or let's call it dysfunction, in the absence of hard neurological disease or injury.
Exactly.
And so, it's interesting that this, and I can't remember exactly how you said it, but something you said really kind of brought me back to something I was talking about just a couple of days ago with Jared Siegler. When I talk to patients about brain health, and, from my perspective, I talk about the better brain equation, right? You can take pretty much any brain, and let's assume for the moment that like it's not a diseased brain, but you can take any brain that's not working well and help it improve its functionality and performance by doing one of two or maybe both of these things. And one is brain activation or stimulation, and the other one is improving the biochemical environment that the brain lives in. And so going back to this idea of, is functional neurology different and distinct from functional medicine? Personally, I don't think so. But there was a long period of time where the disciplines of functional neurology and functional medicine, which both of those have clearly evolved over the last 10 to 15 years, where they were kind of following their own paths and trajectories as disciplines, and they didn't really diverge unless you had some like wonky weird person who kind of early on saw the connections. But now it seems to me that a lot of the people that are learning functional medicine are also learning, and kind of like what you did in your last year or so of school, is that you kind of saw like these are at the very least complementary thought processes in subcategories of disciplines. Do you tend to see it the same way?
Yeah, 100%. I mean, that you said it the best. I think, one complements the other, and our focus is trying to build positive neuroplasticity in the system. And I don't think you can do that optimally without a really healthy biochemical environment for the body and for the brain. So, yeah.
So there's in our world, there's been a discussion, maybe more of a heated debate as to which one should take priority over the other. And, I'll share how I see it, and I'd like to get your feedback and how you see things. But, in cases, and I think most of us doing functional medicine have seen an explosion of really complex and chronic diseases. Somewhat, obviously, a lot of these are autoimmune cases. Some might be direct autoimmune against neural tissues, maybe not, but at least the brain gets involved somewhere along the way because of all the metabolic challenges that these people have. And so the debate kind of centers around, well, should you take a brain first approach and then the metabolic stuff takes a second seat? Or do you improve the metabolism of the body to allow the brain to respond better somewhere down the road? Or is it always an either or do you have a flexible approach where you can look at a case and you can make a case by case decision? This person might need more metabolic work before we get into heavy brain exercise or stimulation, or maybe someone needs some brain activation to get the metabolic state to improve. And we see that quite a lot in things like, neurodevelopmental diseases, concussion, brain injury, neurodegeneration, particularly as it relates to things like the brain-gut axis. So how do you see those things, like the metabolic side, the neurology side, and how do you as a clinician that does this stuff all the time, how do you make your choice on a case-by-case basis? Like, what are the signs that you look for that says, hey, go this way first and then go that way, or vice versa?
Yeah, it's so patient specific, honestly. I kind of approach them both at the same time. Like we have that conversation up front.
Yeah.
A lot of times we'll meet a patient who's been working on their nutrition and with a functional medicine provider. And then we try to just kind of come in and complement everything that they've been doing. But if they haven't, because, we'll also get your typical like 16, 20, 25-year-old whose diet is fast food and eat whatever you want and still be in insane shape. But you have to have that conversation like, hey, you may not notice it now, but you're just not getting the right nutrition in. And if we're going to get the most out of this therapy, we've got to really focus and get a handle on the nutrition. So, it's tough. Case by case basis, to be honest with you. Whatever the patient's willing to do, the labs typically show them what they need to do.
Sure.
But we'll always start out with whatever the patient's willing to do and try to tackle that important conversation on the first visit.
So when people come in to see you, is your initial evaluation include some kind of a metabolic workup as well as a functional neurology exam? Is that how you handle things?
Typically like a metabolic screening, I would say. We usually will do a full neurological exam and then make recommendations based on symptoms, presentation, what might be like a recommended lab, but we'll always ask the questions to try to guide us in our clinical thought process for the functional medicine side.
Yeah. And I know I said this, I didn't want to turn this into a funk neuro conversation, but just for clarity, and I want to make sure that kind of everyone gets to learn something. Like, what's the difference between a Func neuro exam and the standard neurological exam that pretty much we all learn, whether we're DCs or medical doctors or acupuncturists, where you check reflexes and you might do some cardinal gaze work, and that's pretty much everything's within normal limits. Like, how is a Func neuro exam different in that respect?
So it's similar but different, right? So I always say to people learning this stuff, it's really what lens you're looking through. So some of the tests are very similar, but for example, like if you're testing someone's balance on a pathological neurological exam, you would say, okay, this patient can balance, let's move on. But then the question becomes, how well can they balance? When does the patient fatigue? Are they worse on their right versus their left? Are they worse with eyes open or eyes closed? Can they do something else while they're trying to balance? So you try to like extrapolate different parts of the brain, maybe just taking a little bit of a deeper dive to see if an area is working and just not working as well as it could. So it looks similar but different. And some of that could be a nutritional issue. Some of it could be a neurological issue. Some of it could be a little bit of both. But
is it fair to say that there's more of a look at the qualitative performance rather than just having like a binary, you can do it, you can't do it?
Yes. Yeah, for sure.
Yeah.
And then using some objective testing as well, like getting some objective data on the eyes are moving. How well are the eyes moving? The balance is there, but how well is the balance? How well is their balance in a different head position? How exhausted is the patient after a very short exam? Stuff
Right.
like that.
So are you guys doing kind of like bedside exam, not bedside, but you're doing kind of quick and dirty exams, or do you have VNGs, CAPS machines? What kind of equipment do you guys have in your practice to help on the Func neuro side from a diagnostic standpoint?
Yeah, the majority of information I get, honestly, is from the patient's history. So I always, I try to review everything, and I have an idea in my mind of what to look for. But we use QEEG in the clinic for looking at brain waves, different lobes and different function of the lobes.
Right.
We also use balance assessment testing. I personally don't have a VNG unit, which looks at specific eye movements. But I feel like that I've done this long enough to get a good idea. Some people would argue that, you can't rehab the eyes unless you have that objective VNG. But yeah, we use some objective, mostly, to be honest with you. I'm sure it's the same with like strictly functional medicine. You get so much from a patient history. It's like,
right. Sometimes you don't need to do a stool test, for example, or, something like that. So it sounds to me like, again, for the uninitiated, there's just a lot of similarities in terms of the thought process and methodology between functional medicine as a metabolic approach and functional neurology as a neurological approach. Let's transition. But before we go, can you give me, I know that you've got I think I do, if it's still up there. Don't you have a short course, kind of like an introductory course on functional neurology with IAFNR? And is that something, can we get a link for that I can put in the episode description? Anybody wants to learn more, they can just click on that.
Yeah, I think we did a free course just because, like, for me, making a short course, I still had trouble learning this stuff. Like, there's so much stuff to learn, just like in functional medicine.
Well, you're never done.
Yeah, it's crazy. You go to bed at night and you're like, do I even know what I'm doing? But yeah, so I created a course with Dr. Brandon Brock. And I don't know if you know Dr. Kyle Daigle. He's in Lake Charles.
I've texted with him a couple of times, but I don't think we've ever met in person.
Okay. Yeah. I put together like a very just basic course, and then I broke it down to even more basic. And we gave it away to IAFNR members for free. And I'm sure we could do the same here. I just got to check with Janice Hughes. I don't know if you know Dr. Janice Hughes. She's Canadian.
Okay, there you go. I like her already.
She's a chiropractor. She's amazing. She's basically like our executive director.
Yeah.
Because I sent her all that and then she took care of it. So I will find out for you.
Okay, that's awesome.
Yeah.
All right, so let's go back then and let's talk about your decision, which seems to me you must have made that decision pretty quickly after you got out of school to get more education, go down the nursing route, and ultimately become a nurse practitioner. And before you talk about that, I have to tell you that, there was a time when my kids were really young, and my kids are all, out of the house now. 3 of 5 of them are married. So I'm talking a while ago, that I had this idea, like, I should probably, maybe become a nurse practitioner or do an MD degree. But my family was large. It was very young. I was working 78 hours a week, and I couldn't wrap my head around how can I get this done. And so I didn't. And then I see guys like you and many others who have kind of crossed over from an interdisciplinary standpoint. And I'm like, crap, if I had done that, I would have been an NP or an MD 15 years ago. Yeah. And here I am, and there you are. And that's fine. Everything works out the way it should anyways. In my opinion.
There's no way I could have done that if we had kids. Like, I mean, I don't think I could have and been a good husband and father. So I think you made the right choice.
Ultimately that was kind of what it came down to. It was like, how thinly can you spread yourself without something breaking? So what was it? Was it something? Well, I don't want to put words into your mouth, but what was your motivation to do that training and get your nurse practitioner degree?
Oh man, it was one of those like moments again. Like I told you about the Dr. Duffy moment where he was like, if you actually applied yourself,
you can make something of yourself.
Yeah. Cause I was never going to be a big body lifter dude, but anyways, a neurology seminar, Dr. Brock, I remember this specifically because he was sitting right behind me and I didn't know he was a speaker, and he just like tapped me on the shoulder and he's like, "Hey dude, you got any gum?" And I was like, "Who is this jerk? Like, I'm trying to listen to this. I'm trying to listen to a really good talk from one of the other presenters." And I was like, "Yeah, sure. Like, get out of here." And then he went up and presented. But at the time, I think he was just finishing his NP program. But his presentation was on like the functional neurological exam. So like understanding the nervous system, but how medication impacts that.
Yeah.
And I was just like, wow, this is so cool, because in chiropractic school, in our program, sometimes it's like, oh, medicine is bad. Like, all this, you hear all this rhetoric. And for me, I never really had that mindset. Like, I never had anything against medicine, but I always grew up and my focus has always been living a more natural lifestyle. But I was just curious. And so after hearing him speak, I started bugging him, and it took me a while to kind of like get him to respond to me. And after speaking with him just a little bit, I told myself, after I graduate, I'm going to work for 6 months. If it's 6 months, I'm not even thinking about it, then I won't go for it. But at 6 months, I was still thinking about it. So I went for it.
So you went for it. Yeah. And obviously it's a big time commitment. And how radically different was the educational mindset? That's not the right way to say it. Like, chiropractic has a philosophy. Allopathic medicine has a philosophy. Same thing with naturopathy and so on. Was it difficult for you to shift your mindset and to kind of let go of your chiropractic bent as you were going through? Like, did you find yourself fighting against some of the things that you were being taught?
Yes. Yeah. It was weird. I loved it. Like, I loved learning like the other side of medicine and of healthcare. But there were some things that like, I didn't like seeing, because you see people like patients, you see them at their worst, and you kind of see, I went to nursing school at Duke, which we had to work in the hospital. And before I went there, like, to me, Duke is like, it's everything.
Yeah.
And so, the reason I say that is because like you expect to see like, just like top notch. And sometimes that doesn't, I don't know, just some of the stuff you see in the hospital doesn't come across that way. So there were things that were just amazing that I'm so grateful that I learned and that I love. There were some things that like made no sense to me. And I kind of I didn't turn a blind eye, but I just told myself, like, pick out what I really like from this and apply it to my future patients and stuff like that. So I will say this: nurses and chiropractors have two completely definitions of what holistic means. Because when they would say holistic, and then what I would think in my head, and then what I heard them say, I was like, that just doesn't vibe with me. So what is that? Like, how do they define it, and what's the difference in your mind?
It's just,
I can't really explain. It's just different. Like, holistic is still like medicine, injection, but being nice about it in a way, which I'm a nurse. So like, I don't want to speak poorly about
Sure.
that, but like, it's just a different mindset, to be honest with you.
Yeah.
One of the things I always think about is like, I don't know what my clinical thought process would be if I did that first compared to chiropractic.
Yeah.
But what I learned in chiropractic school, it really just validated my personal beliefs. And then, yeah, you try to cross that over to the other side of medicine.
Right.
But on the other hand, too, you meet so many people in the medical world who won't touch this, won't take this, who are very much into alternative healing methods.
Yep.
But they live in a completely different world. So
yeah, and that subfraction of allopathic medicine is growing. I don't know that it will ever be like a large percentage, but if I look back to 2008, for example, when I first started teaching Func Med seminars, if we had one medical doctor in a class of 30, 40, 50 people, that was unusual. Now in the last 5-7 years, maybe even longer, if I don't have a couple of NDs, some nurse practitioners in any given class, no matter what the topic is, that would be unusual. And so, the demographic of people getting into functional medicine in terms of their credential background has shifted a lot, at least in my experience.
That's also because you're a really good teacher.
No,
seriously, man, I've been to your courses.
Well, I appreciate that. I do. I really appreciate that. So how has your nurse practitioner training and background, how has that changed how you see people? And let's just kind of confine it to the complex chronic illness, right? Not the simple, obvious type cases. Like, how has it changed your clinical thought process and or approach? And the reason why I ask this is because I've talked to several people in the past who have gone on and either done MD, DO, or NP training after being a chiro. And a lot of times they'll tell me like, I really got into being whatever because I wanted the ability to, take people off medications or, to be able to manage the medications from a more naturalistic standpoint. Like, so how has your NP training affected what you're actually doing in clinic today? Or are there two different Ryan Cedermarks? Like if you're working maybe in a clinic or a hospital setting as an NP, do you have to shut off that part of you that is more chiro, func med, func neuro, so you can do that job? Or how do you blend them together?
So there's times when they're totally blended and there's times where I'm wearing two different hats. But I think like my core philosophy is always spoken with the patient about how they can make progress in their current situation, where maybe they should shift their focus towards for healing. So yeah, like Monday afternoons, I work with a spine surgery clinic. I'm mostly working with patients who have had brain injuries, but it is a completely different setup and a completely different model from what I do on my typical like 9 to 5.
Yeah.
But I guess what I'll say about that is, I didn't go into going through the nurse practitioner program to be able to just say, hey, let's get off medications. I really just wanted to have a better understanding of like how the other side learns for diagnosis and for treatment, and then how to basically try to complement that and shift people more towards doing things alternatively safely.
Right.
Because I will say this, like when I first got out of chiropractic school, like with my philosophy, I'm like, you don't need to be on that. You don't need to be on that. Like this is just silly. But part of that was the ignorance of me just not knowing, like, some of these medications you can't discontinue right away, yada, yada, yada. So I just, I don't know. I really love having those conversations because you know better than anybody, the majority of these illnesses that people are suffering from, it's habitual things, environmental, lifestyle.
Right. Lifestyle stuff. Sure.
Yeah. If we can work with them on that and then make the change, that's the best. So yeah. I know it's different. It's weird. Yeah. It didn't really help with my undiagnosed ADHD. I'll tell you that much.
Do you think becoming a nurse practitioner has made you a better clinician overall?
Yeah, I think so. It was humbling. Going through, I went through an accelerated 16-month nursing program to get my BSN,
yeah.
which you have to have foundationally for your MP degree.
Yep.
I went into it a little bit cocky because I had recently just graduated chiropractic school. I'd taken on extra, continuing education learning, but it's tough, man. Like any good nurse that like you've ever been in contact with, or just someone who's a hard worker, like they're people. And having someone who's dedicated in the nursing field is amazing, because I think the program is pretty humbling. But
was the training hard from like complexity of the concepts, or is it more the workload, or a combination?
So it's weird. I guess a combination. So it was weird for me because I kind of had to backtrack. Like in chiropractic, we learned from basically like a primary care perspective, how to understand the physiology, treat and diagnose, and that. In nursing, you're like just going really, really, really deep into these very bad chronic illnesses and other words. But you're also, during the testing, like to pass your NCLEX, the testing is a different way of thinking. I don't know if that makes sense, but like the nurse practitioner program for me was way easier than the nursing program.
Interesting.
Yeah. But
is it because you think you pass some kind of a critical threshold that once you're over the hump, everything else becomes easier? Or is it like, what's the difference there?
I don't know. I don't know. I mean, yeah, I felt like I got a little smarter. Maybe that helped. Being in the field and seeing patients clinically, like I worked in the hospital for a little bit. So yeah, I don't know.
Do you ever butt heads with NDs on staff that you're working with, wherever you're working, like really fundamentally disagree with what they think the problem is, or what they're suggesting to do about it?
Actually, so most of the time, I never, if I'm working in like most of the medical doctors I collaborate with, they all know I'm a chiropractor and a nurse practitioner. In the state of Georgia, you have to have a designated physician who oversees you. But like, for instance, when I first started working in the orthopedic clinic, which I love neurology and I love functional medicine, but orthopedics is so much fun. So anyways, I was working there, and I've actually become good friends with this guy, but he didn't know I was a chiropractor. He's our extremity surgeon. He does shoulders and knees and all that. And he hates chiropractic.
Really?
Yeah, he just like, he doesn't like it. Like he's very, very evidence-based, yada, yada, yada. And so he made a comment one day, and I just kind of was like, dang, man, that was pretty brutal. And I didn't say anything. And then he found out later that I was a chiropractor. And then a couple of months after that, he came up and asked me for an adjustment. So, and now we're good friends, and he texts me his Wordle scores. I don't know if you play Wordle, but
no, I don't. No, that's funny. So, talking about joints, I had this shoulder here. I tore my rotator cuff of my bicep tendon last summer when I was up in Canada. And this was probably August, September. And of course, I'm not in the Canadian healthcare system anymore because I've lived in the States more than half my life. And I had to wait until January to get back down to the States to get MRIs to prove that I had tears. In fact, I had bilateral supraspinatus tears. And this was all superimposed over a lot of degenerative change because I was a high-level volleyball player for, throughout my college and after college years. And so just injury after. Yeah. And so I tore, basically punched a hole through the supraspinatus, torn bicep tendon, long head of the bicep, and some cartilage tears. And I have like a rare congenital deformity where a portion of my the cartilage rim around the shoulder, I'm missing a piece at like the 1 to 3 o'clock position. And it affects like 1.2% of the population. I just happen to have it. And so I had that surgery in April of last year. And I texted you earlier today, like, hey, can we change our time a little bit? Because I was in the gym, and it's only in the last couple of months that I've been able to get back into the gym and start lifting weights to the point where I'm satisfied with what I'm doing and feeling my strength and all that kind of stuff come back. And
you do like heavy stuff though. You're like CrossFit stuff.
Yeah.
Right?
Yeah. And in fact, the funny thing about the injury, and we're way off topic right now, but I'll finish it just because I started. I guess it was a year and a half ago. I was lifting in Canada. I just started getting into a good routine, and I'm like, okay, I'm going to start Olympic lifting again. So I started doing some cleans and jerks and presses and this kind of stuff. And I just went too heavy too soon for the flexibility that I had lost. And I never actually had an injury moment. Like I never did a power clean and then a push press and went, ow, and dropped the weight. It's just, I started with some pinpoint soreness right in the anterior delt, and progressively over the next few weeks, it got worse and worse and worse. It started going down my arm, and it was bad. I mean, like, I'm talking bad. Now, here's the interesting thing, and why I bring it up to kind of circle around to functional medicine. When I saw the orthopedist in Florida in January of last year, he didn't want to do MRIs initially because he thought I had some kind of a systemic inflammatory arthropathy. And so we ran basically every Cyrex test that you can think of, absolutely nothing. I had lived on full daily doses of ibuprofen and acetaminophen for 6-7 months in a row. Like I'm talking very high doses, no leaky gut, which like blew my mind.
Yeah.
When we did some labs, we were looking for all kinds of autoimmune issues. Nothing was there. My HS-CRP was 89.
Oh, dang.
Yeah. Like I saw that. I'm like, oh crap. Like, am I going to die? And within 3 weeks after the surgery, that was down to like 42. And then another month, and it was back to normal. It was insane. It was and it was, it was all from that injury.
No way.
Yeah. Like, you said earlier, like, do I even know what I'm doing? When I went through that process, it really kind of made me sit back and start wondering, like, what the heck do I really even know? Like pretty much a year on max doses of over-the-counter NSAIDs, and I don't have a leaky gut, and I wasn't taking any leaky gut support. And to look and see, like, I had systemic inflammation, like an HS-CRP 89. That's the highest number I've ever seen in anybody that I've treated.
That's
I've never seen it that high. And it was all from a local orthopedic injury. I mean, that to me kind of blew my mind, right? And then,
me too.
So, just like, wow, what's that all about?
That's the importance of functional medicine, though.
Yeah,
I
absolutely.
mean, and I guess orthopedics.
Yeah, that's right. Yeah. And, luckily with the background in both neurology and chiropractic and knowing biomechanics and being physically active pretty much my whole life, I did all my own rehab and, progressed quite well. And, I don't anticipate I'll have any limitations once I'm over this final phase of rehab. So, that's been a good thing. So I'm like you, that's like, amazing. I don't hate medicine. I've certainly taken my share of over the counter as well as prescriptive medicine. I've had multiple joint surgeries. Like I had the reconstruction on the shoulder early 2020. I had both my hips replaced because I had bilateral cam deformities, so, I try to see personally, I try to see everything in a continuum, and I truly believe in the right tool for the right job at the right time. Right? Because sometimes someone needs allopathic intervention. Sometimes they need meds. Sometimes they need surgery. Sometimes, like you said, a lot of these chronic diseases are being driven by diet and lifestyle factors. And that's where functional medicine really tends to shine. I personally love it when a new client comes to me and they've seen all the specialists and they've been scoped and scanned and tested and nothing shows up. I love that because I feel like, okay, I'm not going to get bitten by something that's unexpected and hidden. And that's where the kind of work that we do on the Func Med side really, in my opinion, really starts to work its magic. How do you identify yourself? Like I texted you this question just kind of as a teaser, but Like, do you think of yourself as a chiro who became a nurse practitioner, or in your mind now, are you a nurse practitioner who used to and still does chiropractic? Or
Yeah,
is there a third option?
yeah. I mean, I go by Ryan. So,
Nurse
I
Ryan?
just, yeah, yeah. Honestly,
Yeah.
whatever people are comfortable with. I think, like for me, I'm a chiropractor, and I have my nurse practitioner degree. That's usually how if people ask.
Yeah.
But yeah, that's yeah.
I know you're short on time. We got about maybe 10, 15 minutes, but
Yeah, no.
I'm fascinated by the different clinical models that people use in functional medicine practice. And I think that that's completely informed by their education, their expertise in certain areas, and by their own clinical experience, and whether or not people know it. I think you can develop clinical models and frameworks subconsciously. Have you ever sat down and kind of really thought, like, this is how I work? Like, this is what I think is most important to look at in most circumstances. Do you have a model in your mind, either subconsciously, that you can think about and bring out, or have you ever actually sat down and formalized, okay, this is my clinical model? And if so, what does that look like?
So it's so weird when you texted that, because I had this conversation with my wife this weekend. We were driving to a dinner, and I was working with a patient last week, a tough patient, and I had been thinking about this before that. But basically, I've become, since working with this one particular patient in like late 2017, early 2018, obsessed with really trying to figure out the importance of the vagus nerve. And I think if we look at functional neurology and functional medicine, I think the vagus nerve is what marries both of those.
Yeah, that's the interface. Yeah.
Yeah, super magically. Just because I had this one patient. I don't know if I'm going to tell you a story, but she had been everywhere, and she was seeing functional medicine providers, like the top gastroenterology lady here in Atlanta, and she was referred to me for more functional medicine evaluation. But when I did my exam on her, I just asked her, I was like, have you ever had a head injury? And she had a head injury. Like a large microwave fell on her head from a shelf, and that's when her symptoms started. But no one had ever really like looked into the brain and looked into the connection between the brain and the gut. Her symptoms when she got to me was she couldn't eat. Like, she couldn't eat anything. She was on an amino acid based like powder diet, like an elemental diet, basically.
Yeah.
And so where I went to in the research was, what's the connection between the brain and the gut? At the time, all I knew was like the vagus nerve helped us sleep and poop.
Right.
But the more I learned about it, the more I learned how things in life, like physical trauma, an emotional trauma, a stressor, can totally derail the brain gut axis,
Right.
specifically like negatively impact the vagus nerve. So just going back to that, we did a ton of work with her on her concussive symptoms, but also stimulating her vagus nerve. And she ended up getting a lot better pretty quickly compared to where she was in the past. So for me, my whole like approach with patients, my initial approach is I try to understand how healthy their vagal tone is, because I truly believe that vagal tone and a healthy vagus nerve sets the stage for proper neural foundation. And whether that goes into like them being able to like accept nutrition well in their system and utilize the nutrition well for better brain health and body health,
Right.
or just overall like better nervous system function. I think like if the vagus nerve isn't working as well as it could, then you don't have that strong foundation to build upon. So I always start there with our questions, with our assessment. And then vagus nerve work in different forms and fashion is always part of someone's homework,
Right.
Whether in the clinic or at home. So yeah, my whole like clinical pillar thing, it starts, I just call like, I read Stephen Porges's work, the polyvagal theory. And again, like when you read that stuff, it's all neurology. He's a researcher, but you can't not think about nutrition and functional medicine. So anyways, he just talks about how the myelination of the vagus nerve sets the neural foundation for proper cortical maturation and things like that. So yeah, if I had to say anything, it's checking foundational vagus nerve health.
Yeah. So I know you probably have to go in about 5 minutes, which means you're not going to answer the question that I want to ask.
No, yeah.
Would
ask
you?
away.
But do you think you could come on again and we can have like a conversation that's dedicated to that topic where we can just talk all things vagal and kind of go through the neurophysiology, the brain gut axis, and the vagal system is much more complex than that, right? It has influences on other functions rather than just kind of driving that gut enteric system. But can you spare some time?
Yeah, I would love to if you'll have me back.
Of course.
I sometimes, you talk about like talking to my wife at dinner. She's a physical therapist. She works in the ICU here at a hospital, but sometimes I feel like I bore people, but this is the stuff I love. Like I get super pumped about this just because you see like, hey, like what's happening in the research is so clinically effective, and you can really just make a positive change in the body, but then also the brain, like you said, there's so much more to the vagus nerve. Like this one paper I'm kind of stuck on right now, it's a hypothetical paper of what's happening in the brain, but it shows all these pathways kind of just like lighting up like a Christmas tree when you provide the right type of vagal nerve stimuli. So I don't know, like for me, it's if you have a better body, you can have a better brain. If you can have a better brain, you can have a better body. So
yeah.
I'd love to.
I think fundamental tenet of like Func Neuro, right? It's like the brain is at the apex of the hierarchy. But it's you can't escape the concept that the brain is living tissue and it needs good biochemistry too. And this is kind of circling back around to something we chatted about right in the beginning, is that functional neurology and functional medicine are so intricately linked. I think it's difficult to separate them. It's sometimes you have to, just for the sake of conversation and perhaps even education. But at some point when you're talking about practical clinical applications, especially in the sickest of the sickest people, I think you have to pay attention to both. And if you don't, then you're, perhaps not serving that person in the best capacity that they could be served in.
Absolutely. Yeah. And I think every functional medicine provider would agree, like the body needs input, like it needs sensation, it needs like socialization, but it also needs physical exercise.
Yeah.
So, physical exercise is a form, in my mind, some people may disagree, of functional neurology. Like you're doing something complex with your body to stimulate your brain, and you can do it better with functional medicine. So I don't know.
And I don't know if you ever took the brain chemistry seminars that I've taught.
Yes.
You have. Okay. So, I may have said this during that seminar.
I was sitting in the front row, like asking you a bunch of questions.
Oh, that's right. I remember you.
I'm just kidding.
No, I'm gonna say something, but I have to give credit where credit's due. I took this from Tom Culleton. Yeah. And so he said at one point, he said, exercise is brain nutrition. And I'm like sitting back and like, that's actually a really profound concept, right? When you understand how the brain works and the role nutrition plays in that, and what happens in the brain when you wave your limbs around in patterned and unpatterned ways. I mean, it's just such an amazing connection. And how cool is the human body, right?
So cool. It's crazy.
I know.
And like, again, there's so much, we don't know, which is it's so humbling, because
I know. Yeah.
I mean,
dude, listen, I know you got to go, but I wish we had another hour or two to keep going on the conversation. So I'll reach out to you and we'll see if we can find another time where our schedules sync up, and we'll just extend the conversation if that's okay with you.
Yeah, I would love to. And thank you so much for doing this. I'm grateful to speak with you, and congrats on the new podcast.
Yes, thanks. And it's good to see you. It's been a couple of years since we've been face to face.
Yeah. You're on the road all the time.
I know. I'm hard to catch.
I'm just kidding.
Cool. All right. Dr. Ryan Cedermark, thanks for hanging out for the Func Med Nation podcast. We'll talk to you again soon.
Bye, everybody. Thanks.